Hey, my name is Madison, and I'm going to be doing a central line dressing change. First, I would come into my patient's room, wash my hands, put on clean gloves. I would identify my patient and verify my physician's orders for the central line dressing. Some reasons that we would initiate central line dressing would be such as if the patient is getting a large amount of fluids or if the patient is taking medications that are could be damaging to the veins, such as vancomycin. And why we would change the central line dressing would be to prevent infection. So I've washed my hands, put on my clean gloves. Next, I would put a mask on my patient if the patient cannot turn their head away from the central line area. So this would be on the patient. Next, I would carefully peel away. I won't do that just for demonstration purposes, but I would carefully peel away the old bandage and remove the bio patch and place that in the biohazard bag. Then I would take off my gloves, wash my hands, and then put on a new pair of gloves. I only have this one pair, so I'm going to keep that on. And then I would, with my new clean pair of gloves, I would open my sterile kit. I would take out my sterile gloves, place them to the side. I would take out my only touching the 1-inch border, and then I would place that shiny side down. I would take my kit and dump that, and if this were to touch the sterile area, I would get a new kit. Or if any of my items went outside of the 1-inch border or the sterile area, I would also get a new kit. But for demonstration purposes, I'm going to keep going. I would throw my packaging away, and at this point, I would take off these gloves, throw them away, and then I would wash my hands, and then I would come here and put on my sterile gloves. Only touching the 1-inch border. Okay, so now I'm going to I would assess the patient's veins, making sure there's no swelling, no redness, no signs of infiltration. And then I would begin using my alcohol swabs. I would clean in a horizontal direction, throw that away, and then in a vertical direction, throw that away, and then in a circular direction, and then throw that away. And then I'm going to take my ChloraPrep, and I would clean in a circular motion, throw that away, and then I would take my dressing, my new clean dressing, and I would place a new biopatch onto the patient if it's available and it's indicated. And then I would place the new dressing on the patient, making sure it's sealed. And then I would initial it, put the date, put the gauge of the central line, and I would take off my gloves, perform hand hygiene, and then I would document the patient's reaction, the assessment of the central line, the assessment of the skin around the central line, and the procedure. Thank you so much.